Good morning, everybody. You are now watching the Orthopedic Minute here on Iowa Live. And this is all courtesy of DMOS and some incredible information, and it's all about the hips. Yes, and we're going to relate it to some recent news in injury with sports here, as we are very excited to welcome Dr. Chris Nelson to the studio with us this morning. And this is kind of your specialty, right?
It is.
The hips.
It is. I think at DMOS we each all have our own little part of the world, and hips and knees are what I spend most of my time doing. So it's a passion of mine to help patients get back to after injuries to the hips.
Well, let's talk about that passion, and you kind of want to focus specifically on something known as the labrum. So kind of, you brought in some wonderful pieces to show off for visuals. So what exactly do you want to talk about today?
Well, hip labrum, I think it's good to start with what it is. There's a lot of people who still don't know what it is.
Right.
In fact, yesterday I saw a girl, I was thinking about on the drive-in this morning, it's amazing that how long sometimes patients can go without a diagnosis. I mean, this girl yesterday, she's had hip pain for 15 years, and she's in her early 30s, and still without a diagnosis. So it still is a somewhat unknown structure. So it's the hip labrum is basically a cartilage ring that goes around the rim of the hip socket. It sits like this. This is actually the back of the hip. And
I was going to say, is that the front or the back? That's
this is the back of the hip, but this model seems to show it better here. So when this is the labrum, should be attached like this, and when it tears, it kind of peels away from the rim of the hip socket. So they usually happen across the front of the hip.
Right.
But this model just happens to show it better across the back.
Across the back. So when we're thinking a true hip injury, is that usually what's being affected, or what we're feeling when we have pain?
A variety of things. I think a hip injury that's, well, first of all, hip pain is typically across the groin, so that's one hallmark of labral tears. But it's the hip injury that sticks around for a while, that's been treated with physical therapy, that doesn't go away. You can have traumatic injuries like this slide shows here, and there's a few different causes of hip labral tears. So you see those are actually listed in order. Trauma is actually the third most common. So a lot of people will think you tear your hip labrum with injury, but it's actually the third most common cause. So hip impingement is basically just a condition where you have too much bone around the socket, either on the socket side or on the side of the femur, and that's called hip impingement. Hip dysplasia is kind of the opposite problem. It's a problem where the hip socket is too shallow, and it becomes a structural problem where the labrum takes on too much shear force because it doesn't have the structural support to support the hip.
So basically our building blocks of our body can kind of create some natural hip issues, but then also there's some trauma with sports or other activities that we might have at various ages that might cause us to come in and say hello. The patient that you were talking about previously, what kind of pain was she feeling? I was sharing with you during the break that I had hip issues when I was a kid, and it literally got to the point where after I got done with a volleyball practice or track practice, I couldn't walk the next day. But you just say, walk it off, rest, you're fine. What kind of pain are we feeling, and at what point are we saying, okay, red light, we need to come and see a specialist?
That's a great question, because we see a lot. I see a variety of presentations. Sometimes the patients come in right away and they get a diagnosis sooner, but there are a lot of patients who will just keep dealing with these pains that go on for a long period of time, and they're therefore undiagnosed. So hip labral pain is typically a pain that's middle of the road pain. It can be a nagging pain. I see a lot of high school athletes that play with this pain, but it'll hurt them after their activities. The downside to hip labral pain is that it frequently doesn't heal on its own, so it can be pain that goes on for years and years.
It doesn't heal on its own.
It doesn't. That's one downside of the labrum. You don't necessarily have to have it fixed, because when it tears, it usually tears across the front quadrant of the hip and doesn't continue to propagate around that. So we routinely let patients go back to sports as long as their pain allows, but we do see a lot of patients that the pain stops them and they aren't able to do their chosen activity because of the pain.
I think a lot of the time too, we associate hip injuries and hip with older, whereas that's not necessarily the case. What are some of the ways then for people that are experiencing kind of this chronic nagging pain and to be tested for this? To find out if this is...
Absolutely, that's a great question. So usually I think just a lot of people will start with physical therapists. In fact, physical therapy is probably my main referral source. It's the patient that has tried anti-inflammatories, tried resting, gone to physical therapy, and just doesn't get better. That's when they usually get referred to us for an MRI and then a subsequent diagnosis. We also have, work with a lot of sports medicine specialists in town who also recognize these, and it involves an MRI and then diagnosis of the labral tear from there, and then they come see us.
So that's a non-surgical way to treat that. Is there an actual surgical way in case it gets to that point that you would take care of that situation?
Absolutely. So we do try to treat everybody non-surgically, even patients that, a lot of patients that will come in and have this diagnosis of labral tear and assume that they need surgery right away. And we're successful with treating patients non-surgically about 30 to 40% of the time, which is, I think, higher than a lot of people realize. So that's always, even as a surgeon, that's always our preferred way to treat these, is non-surgical. But for the patients that don't get better with that, we can fix the labrum. Hip arthroscopy is the primary way we do that. That's the way across the country where it's mainly done. Basically what we do is we roughen up the bone here, and then we use anchors and stitches to tack down this labrum to fix that. Again, it's that motion in the labrum that causes a lot of the inflammation and pain in the joint. So by using anchors and stitches to tack that back down, we can actually get that to heal. And hip arthroscopy is it's a procedure where we make 3 small incisions on the side of the hip and can go in, and the patient goes home the same day. So it's minimally invasive surgery. It does involve a bit of recovery, which is why we try to treat it non-surgically if we can. But if it comes to surgery, it's a good surgery with good results.
What kind of recovery are we talking about here then with that?
The hardest part is the first month. It's about 4 weeks of crutches. It's 2 weeks of partial weight bearing, and then 2 more weeks of kind of weaning off the crutches. It's about 3 months of physical therapy for the initial strengthening phase, and then 3 months for the second phase. So return to sports is on average between 4 and 6 months, depending on the sport, which is a long time. But you'll see that in the news. There's been some
I was going to say, recently, you were just talking about, because you brought in this other amazing model here we want to show off. What are we looking at here? Well, it's probably pretty obvious, but what are we looking at here?
That's the deconstructed hip, I guess. That would be the femur and the pelvis, and it just kind of shows how the two articulate together. And I brought that in just to show the labrum. I could show a couple things on that.
Yeah. Here, you're the expert. I'll let you have that there, Doc.
It's a fun toy to play with. So let's lay this down here. So this just shows, I brought this in to show a couple things. So this is where, going back to the first part, where we can have hip impingement anywhere around the hip socket, but predominantly across the front of the hip. We see some extra bone here, and again, that's hip impingement. I was trying to just demonstrate that. The second part is right through the neck of the femur, where we get some extra bone. And what happens is, as the patient goes, say, kick a ball or sprinting, running, jumping, flex the hip, those two impact each other and then tears the labrum across the front of the hip. So I brought this in to show how those two articulate. In terms of recent injuries, unfortunately, we were talking off air about what happened to the Alabama football player, and that was a hip dislocation, which is when the hip is dislocated.
And I didn't know you could. I've heard ankles and knees. I've never heard hips, and I can only imagine the pain that's involved there.
Yeah,
it's one of those joints you want to take care of because it's going to affect you the rest of your life.
Absolutely, and we're able to now, and I think that's this area with the labrum is called young adult hips in our practice, and it's kind of the focus on hip preservation surgery and preserving those hips, taking care of them, as you say, as opposed to the other part of my practice involves patients whose hips are arthritic and are worn out, and hip replacement, which people are far more common with. So
absolutely,
I think this is something I wanted to highlight just because it's still somewhat unknown. Again, like that patient yesterday that's gone for 15 years without.
There's new options out there, some non-surgical and some that can be in and out the same day, which is pretty amazing. Doctor, thank you for sharing that with us today. If you want more details on the incredible work that DMOS does on a regular basis, you can always check them out online, dmos.com.
And you don't need a referral.
Don't need a referral.
Wonderful. Thank you for joining us today.
Appreciate it.
Appreciate it. All right, you're watching